Global Fund as an entity came to help us in the year 2002. And the major aspect that were of greater concern then were the diseases that had devastated our community: HIV, AIDS, TB, tuberculosis, and malaria. So the grant addressed issues that had to do with countries' capacity to contain infections of the diseases that I've spoken about. Looking at the amount of money that has been spent, closer to about $2 million, we have seen a great reduction in the number of people that have been infected by agents that cause diseases. Talk about HIV/AIDS, we had a prevalence of 10%. As I'm talking now, the prevalence has come down to about 4.7%. Look at a disease like tuberculosis. Now, this is a silent killer because many people are infected in our society and a majority of them don't even know they have the disease. So through Global Fund, we have managed to equip our health facilities with some of the state-of-the-art diagnostic facilities. So through Global Fund, we have engaged interventions that have enabled people to follow individuals where they stay, to follow and check if their symptoms are concomitant with the disease. The procurement of anti-TBs is one other aspect that has benefited a lot from these resources, but also infrastructure development in places where these patients are handled. Kibongoto is one such place, and also other satellite places that at the moment have been empowered with capacity to handle multi-drug resistant TB patients. 90% of patients get treated and they get cured. So it's only the 10% that we have to work and see which other agents can ameliorate their disease but also bring cure. Malaria, we recently conducted a malaria household survey in the country, and we realized that the numbers are also coming down. So we manage environment to make sure that mosquitoes do not find a place where they can breed easily. We also prevent them from coming into houses by teaching our people that they should prevent mosquitoes from coming in through screening, but also prevent our people from being bitten by mosquitoes by providing them with long-lasting insecticide-treated bed nets. And I believe with the position that we have attained at the moment, our future is much brighter because we are certain of our plans being funded and the commodities being procured, and the individuals to employ these commodities will truly be there to employ them and help our people receive success in this country without going anywhere else. So Global Fund is an ally for the provision of better health of our people in our country.